Students at the back, need your attention. How many of you have heard the slogan, eat, sleep, and repeat? Raise your hands. And those raise your double hands who actually believe on and practice and follow eat, sleep, and repeat. That's really nice. Okay. So, honorable audience, experts, psychologists, distinguished professors from academia, industry, organizations, and NPOs. Assalamu alaikum, good afternoon. And I think it's a great honor and privilege to be here talking about one of a very important area, which is very close to my heart, disordered eating behaviors and eating disorder. To the wonderful audience sitting in the podium. The topic which I would like to give an overview is disordered eating behavior and Asian cultures. ये आगे नहीं जा रहा, ये शायद अच्छा चले ठीक. So before we begin, there was an interesting debate a couple of minutes ago that Dr. Afifa highlighted that while I was giving my PhD defense in this very department, there was a question by one of a professor that there is an eating and there is an eating disorder, and what is meant by disordered eating behavior. So we were just, having a memory of that good time. So basically, disordered eating behaviors refers to troublesome eating behaviors, such as restrictive dieting, binging, purging, which occurs less frequently or are less severe than those required to meet the full criteria for the diagnosis of a full-blown eating disorder. So there is a very clear-cut definition available for that. And when we talk about Asian cultures, and particularly about Pakistan, this is pivotal to note that we hardly seen the cases of full-blown eating disorder, the diagnosed cases of eating disorder in Pakistani community, because still there is a lack of, research available in this area in indigenous population, and people still do not realize the symptoms and, incidence of this disorder. So what we get is a disordered eating behavior symptoms more frequently than the full-blown eating disorder. So this could be considered as a subclinical form of eating disorder. So now there's an interesting thing to see that how disordered eating behaviors are conceptualized. So as I just mentioned that we see that there is a scarcity of research available in this area. Back in year 2004, when I started working on my PhD dissertation, the area I chose to work was disordered eating behavior and eating disorder. So when I start looking around that what kind of the research published material is available for the Pakistani population, there was only, you would be surprised to know that there was only one published research, which was published in British Journal of Psychology in 2002 by a Pakistani researcher taking the sample of adolescent girls of Lahore Grammar School. So that was a big question mark that how I will be able to get data from Pakistani population, where I will be going to assess the diagnosed cases. So I started working on that, and it was really a huge challenge to see that the data collection was not at all an easy task. From where I get data in 1.5 years of a very hard time is from dentist, because they were the patient who come with the loss of dental enamel and other, serious issues, and they think that they should work on those symptoms which could be treatable rather than the actual cause, which is a big problem in our community. And then from the gastroenterologist, because that people have serious issues related to their gastrointestinal area, and then their liver issues and things like that, stomach problems because their lining become very thick due to the constant purging and things like that. So there was the indirect data which I collected, and very few cases were being identified from the adolescent age range from nutritionists, because the parents took them to different, diet experts and nutritional experts. So I took few of the sample from them. So just mentioning that journey means that it was not at all easy thing, because the concept of eating disorder and disordered eating behavior was not being understood in community by that time. But gradually, when I was working on my thesis and I submitted that in 2009, I was happy to see that there were some good researches coming up, like as my professor was Professor Dr. Ruhi Khalid, so we published together. Then I saw some eminent researches published by respected Dr. Najma Najam with some Hanzala and other researchers. So I have been, collecting evidences from all the researches by systematic literature review, even after completion of my work. Then interestingly, very few students were interested in working in that area. And after a very long gap, I have realized that we have to do something which should be, latest and in this coming age. I'm very glad that with the help of Pakistan Institute of Learning and Living and Learning, now 4 of my MS thesis students are working in different areas with collaboration of PIL and with Dr. Nusrat Hussain and Aisha in translation, adaptation, in developing integrated therapy and different areas which are very important in looking for the advancement of treatment for eating disorder. Okay, then looking at the conceptualization, this is just a brief overview that as we see that there is an intuitive eating first, like the eating for nutrition, for pleasure and joy, where we respect and accept our body, and we are aware of the hunger and need for the body, that what should be eat or not, and there's no preoccupation with body image. This is one side. Always remember there's a very strong connection with eating disorder and body image disturbances, because both goes hand in hand. अभी recently शायद आप में से कुछ students ने देखा होगा, there is a shift in media industry. जैसे खाड़ी ने भी अपनी models जो हैं उनको जो recent launch की हैं वो बड़ी उन्होंने एक different techniques से launch की हैं. उसमें अब वो कोई zero size models नहीं हैं. They have models like me who are overweight, and they are models who are of dark complexion, या models हैं जो different ethnicity या race से belong करती हैं, and they all are their models. And it gives a very good, feeling when you saw that हर कोई उनके कपड़े पहन सकता है, ठीक है? So I think कि हमें इस तरह की चीजों को promote करना चाहिए, क्योंकि ये चीजें फिर एक तरह से हमें, जब हम ज्यादा thin body ideals के ऊपर focus करते हैं तो eventually they restrict our eating preferences, and उससे हमें issues शुरू होते हैं. Then other thing is that we see कि full blown eating disorders जो हैं वो तो हमने अभी सुबह से बहुत बात की. There is anorexia, there is bulimia, there are avoiding distinct food intake disorder and many others. But in between, I think the problem emerges when the person goes off and on into dieting regime, right? आप में से सब लोग ऐसे होंगे, अगर मैं पूछूंगी आप में से कोई ऐसा इंडिविजुअल जिसने कभी डाइटिंग ना की हो, तो बहुत कम लोग होंगे. I'm sure there are hardly 1%. ठीक है? So we, one से ज़्यादा, you are blessed with having this kind of body type then. So we generally avoid or exclude certain type of food groups from our diet. Isn't it so? Because हमें लगता है कि ये constantly ये groups food के लेना शायद हमारी body को suit नहीं करेगा. Then फिर ये कि secretive eating and hiding foods is another issue. And late night eating, I think this is one of the thing जो food panda के आने के बाद बहुत ज़्यादा हमारे adolescence में prevail हो गया है, unhealthy eating and late night eating. So I think so these are the things, like different areas we have to see कि the severity of the behavior is not important, but the type of the behavior and the incidence and prevalence, that how frequently they are going to happen, they are definitely severely going to affect the quality of life in an individual. So हमें इसे देखने की बहुत ज़्यादा ज़रूरत. Now talking about prevalence, I will not go into this detail because prevalence statistics I think you have been hearing since morning. But important thing is that there is another type of eating disorder which is otherwise not specified, is also on a rise. So we need to see that as well. Now, if you look at the prevalence in Asian culture, like we have the assessment challenges in Pakistan, we also have assessment challenges in other neighboring countries in Asia. As far as we see that the reporting of disordered eating behavior was largely absent from Asia, with the exception of Japan. From the very beginning, the statistics from the Japan was coming up that it's on the rise from the mid-1970s. Reason behind, they were actually doing research on that. So that's why we were having the statistics available. And in Pakistan, since we started late, so the statistics started coming late. So the other countries after Japan who led the pack, like Hong Kong, Singapore, Taiwan, South Korea, and then other neighboring country like Philippines, Malaysia, Indonesia, Thailand, and lastly China and Vietnam. So what I believe is that कि जहां हम इंसान हैं, जहां हम खाते हैं, वहां पर जाहिरी बात है कि आपके फूड रिलेटेड प्रीऑक्यूपेशंस एंड प्रॉब्लम्स भी होते हैं. सो इट्स नॉट लाइक दैट कि किसी भी जगह पर ये ना हो. Of course, the vulnerability factors could be different. Of course, the familial factors could be different, but definitely वो होते जरूर हैं. So, mirroring this pattern, disordered eating behavior were initially reported less frequent in less developed poor Asian countries such as India, Pakistan, Thailand, Indonesia, and Philippines, Cambodia, Myanmar, Laos, and Vietnam. But gradually, हमने ये देखा कि incidence और prevalence कम जरूर थी, but as far as the research goes on, we see that with the passage of time, we also see कि in countries में भी जो है वो incidence बढ़ रहा है. So Japan being the highest, now India being the second lead, and then, you know, it goes on and on. So these are few of the very important findings which I would like to share, particularly with reference to Pakistan, जो मैंने अपनी research में identify की. I just mention it in one slide, जो मुझे बहुत important और crux की लगी, कि there are significant gender differences in eating disorder behavior. And as we see that international perspective में भी हम देखते हैं कि the females are higher on risk. So we similarly see the same pattern in Pakistan, that women are higher on risk as compared to men. And then another thing which I explored, that there are the difference in disordered eating behavior with reference to socioeconomic status. In Pakistan, what I see that the upper class on average has more disordered eating behavior as compared to the middle class. But this is not the case with all across the world. We see that in some part of the world, the people who are belonging to low socioeconomic status can also have this problem. And in some part of the world, of course, the people belonging to elite class are having this problem. So there is a difference in with reference to socioeconomic status. But in Pakistan, what I assessed is that upper class is having more this problem. Maybe if we dig this phenomena in detail, we will be able to identify that on a very, very lower income group who are generally not become the part of our data collection may also have these reported symptoms. Then there are the significant difference in disordered eating behavior with reference to family. In my coming slide, I would be talking about how familial factors are important, but nuclear family system has increased tendency as compared to those who are living in joint family system. This also makes sense because हम जब इसकी etiology पे बात करते हैं, जब हम इसके protective factors पे बात करते हैं, तो हम ये कहते हैं कि जहाँ पे लोगों को isolation में बैठ के खाना खाने का मौका मिलता है, जो family के साथ अपने regular meal timings को follow नहीं करते, वहाँ पर ये problem जो है वो हमें ज़्यादा नजर आता है. So briefly looking into the vulnerability factors, they are the psychological factors, they are the environmental factors, the biological factors, and then of course there are the triggerers which could be a stressful situation in life changes or a trauma in environment, in your psychological world, in your biological world. So the environmental factors, I would be like to mention that अगर हम bullying and abuse की बात करें, जिसकी बेशुमार abuse and neglect की forms आप सबको psychology audience को, you are well aware of that, I won't go into detail. जहाँ भी हम experience करते हुए लोगों को देखते हैं, उसके साथ ये जरूर link नजर आता है. So this could be one of the factor जो कि हम अपने mind में रख सकते हैं. इस पे मैंने बाद में repeated researches भी कराई. Abuse and neglect are strongly linked with disordered eating behavior. And then of course हमें पता है कि thin body ideals जो हैं ये हमारे एक environmental का बहुत important factor है. ये तो बहुत well established international phenomena है. Then perfectionism, prone to anxiety or depression, low stress tolerance, and fear of being fat and obsessive thoughts. ये these are the psychological factors जो बहुत हमारी एक हमें vulnerable करते हैं इसके लिए. And biologically this is again that family history of eating disorder or mental illness could be one of the factor, and changes in brain chemicals or hormones. And I think on etiological factors Dr. Rafia has given a very good presentation in morning, so I won't go into that detail. Then briefly looking at psychological factors, I think I will just quickly go through them. That psychological factors include dispositions and psychological features like low self-esteem. It has a very, very high link with disordered eating behavior. In fact, when we talk about low self-esteem, you must almost have heard about Rosenberg's self-esteem scale. उसका जो एवरेज स्कोर है, जब उसको हम इंटरनेशनल स्कोर के साथ अपने स्कोर को कंपेयर करते हैं पाकिस्तान के, तो वो 10 डिग्रीज लेसर है. इट मीन्स के जो एवरेज हमारे पूरी दुनिया में यूथ का जो सेल्फ स्टीम है, हमारी यूथ का सेल्फ स्टीम उससे बिलो है. ठीक है. सो देयर कुड बी द डिफरेंट जियोपॉलिटिकल रीजंस, देयर कुड बी डिफरेंट साइकोलॉजिकल रीजंस. We may not agree with this, but this is an established research which says so. So it means that those who are having a low self-esteem are at the greater risk for many mental problems. And this is of course the reason कि हमें नजर आ रही है हमारे यहाँ जो एक mental health का जो एक continuum है, हम सब उसके right side की तरफ जा रहे हैं. Right? Okay. So then the body image, इस पर मैं भाई और बात नहीं करूंगी. And then behavior towards eating, जिसमें हम फिर finally देखते हैं कि हमें eating disorder का incidence नजर आता है. The more important thing in Pakistani perspective is socio-cultural factors. In general, the research by well-known researchers says that increasing prevalence of eating disorder in non-Western countries is attributed to the role of Westernization, economic growth, and I'm sorry, Shayad, I have done some, mistake. Stop. But I personally believe that it's not at all just because of Westernization. This is one factor. But other than that, when we talk about the social and cultural factors which are exclusively related to Pakistan are also very, very important. So I will go into that detail, just have a quick look on familial factors first, then we will be talking about social and cultural factors. The intergenerational conflict, lack of family cohesion, parental overprotection at times, जैसे सुबह किसी ने बात की थी कि overfeeding करते हैं हम बच्चों को, low parental care या फिर दूसरी extreme पे बिल्कुल ही care नहीं करते. Familial achievement orientation, achievement has also a very strong link with eating disorders. And then parental expectations, जो कि अभी तो मुझे लगता है growing world के साथ हमारी बहुत ही parents की बाज़ औक़ात unrealistic expectations भी हो जाती हैं बच्चों से. और अब more recently I think जो the educated class and जो psychologists हैं वो इसको condemn करना शुरू हो गए हैं कि हम positions को इतना focus ना करें, हम achievement को इस तरह से जो है वो नहीं लेके चलें जैसे अब तक traditionally लेके जाया जाता था. Then parental criticism. It sounds very harsh, but it's true that at times parents do criticize their children a lot on their body weight, on their body shape और इस तरह की चीजों के ऊपर. तो ये चीजें भी एक बहुत important factor contribute करती हैं. And then direct parental influence, if they are following any such practices, तो वो भी बच्चों पर असर करती हैं. Now, not going into the detail of what is written into the cultural factors in my presentation, I would just like to mention two things. हमारा culture क्या है? जब हम खुश होते हैं तो हम खाते हैं, जब हम दुखी होते हैं तो हम खाते हैं. दोस्त कहते हैं आज बड़े दुखी हो, लेट्स हैव सम टाइम टुगेदर, और कहीं बैठ के हम खाते हैं. हम सेलिब्रेट करने को समझते हैं कि हमने क्या खाया है. ठीक है, हमारी सेलिब्रेशन भी फूड से लिंक्ड है. इवन हमने डेथ्स पे, जनाजों पे भी देखा है कि अभी किसी को ग्रेवयार्ड तक लेके नहीं पहुंचे और पीछे हम खाने का जो है वो हमारा सामान शुरू हो जाता. तो हमारा कल्चर जो है ना, उसमें हमारी एक इंस्टिंक्ट जो फूड की है ना, वो हमारी हर इमोशन के साथ जुड़ी हुई है. तो वो इमोशनल ईटिंग का जो कॉन्सेप्ट है ना, वो हमें बहुत अच्छा समझ आता है अपने पाकिस्तानी सिनेरियो के अंदर. यहाँ पे आप देखें कि अगर हम किसी के घर जाते हैं और हम कहते हैं जी मेहमान की बड़ी इज्जत की है, वो इज्जत क्या होती है? If we have served them well, अगर जबरदस्त खाना वाना खिलाया है तो वो होता है कि बड़ी इज्जत की है. और अगर कहते हैं जी उसने तो मुझे पूछा ही नहीं, तो वो पूछना क्या होता है? वो अच्छा खाना ही होता है. So when we were having some work into urban and rural contrast, तो वहां पे हमें एक बंदे ने बड़ी मजे की बात की, उसने कहा कि बेसिकली जब कोई मेहमान आता है तो उनके साथ बैठ के चाय तो फिर पीनी पड़ती है ना, तो मैं तो दिन में 12 बार चाय के कप पी लेता हूँ। सो इट मीन्स कि हमारे यहाँ ये वाला कल्चर है, टाइम रिस्ट्रिक्शन है, खत्म है, लास्ट स्लाइड। सो हम कहते हैं कि किसी के साथ बैठ के चाय पी तो हॉस्पिटलिटी नहीं होगी, कोल्ड ड्रिंक नहीं पी तो हॉस्पिटलिटी नहीं होगी। तो आई थिंक ये वाले जो हमारे फैक्टर्स है ना, और इंडिजिनस फैक्टर्स जो तड़के लगा के खाने खाना, वो अब जाके कुछ अवेयरनेस बढ़ रही है, but that has been the part over the many years. So ये चीजें जो हैं वो हमारे cultural factors में हमें link करती हैं towards eating disorder. This is one of the very important statement which I would like to quote. When disordered eating behaviors are culturally accepted and performed with significant frequency by variety of groups, it can lead to perception that these behaviors are normal, which can be determinant to prevention and treatment. इस पर भी पूरे 2 घंटे बात हो सकती है, लेकिन करनी नहीं है, बस बताना जरूरी था. So I think what we need to do in this context is many things, but वो हम अभी अगले 2 दिन उन पर बात करते रहेंगे. I just would like to mention that during my research, I have developed an assessment and diagnostic tool for eating disorder behavior, which has been published in multiple research during the last 15 years. And I'm very happy that we are going to commercialize that tool in recent times. अभी हमने PHEC की एक इंडस्ट्रियल एक्सपो थी, उस पर भी उसको प्रेजेंट किया था, और वो हमारा एक बड़ा विनिंग प्रोजेक्ट भी रहा वहां पर. तो इंशाल्लाह आई विल बी लुकिंग फॉरवर्ड दैट वी विल बी एबल टू डू सम गुड वर्क इन फ्यूचर with the help of PIL as well as with the Institute of Applied Psychology, Punjab University, with an